Welcome, welcome. I'm Doug Kimball. I'm the head of marketing for Red Sky Health, and we're here to talk more again about what it is we do and how our whole process came about. So I'm joined today by our VP of Business Development, Ted. Can you tell me a bit about yourself and about the why you're here?
Sure. Ted Pantaleo, Vice President of Business Development, as Doug said, been in healthcare since the 70s and have known that we had problems with claims during that entire time. So this is an exciting opportunity to see if we can make things better.
Great. I'm excited to have the conversation. We've talked to the people in Red Sky so far, but the other thing I think it's important is to get different viewpoints. So, you're kind of a different role. You're out there pitching this discussion about Red Sky Health, what it is we do, and why it's helping healthcare providers. What's the biggest headache that you're seeing the healthcare providers that you talk to are dealing with that Red Sky Health is helping for?
Yeah, I think you've got multiplicity of issues here right now. We've got complicated claims systems in place at all of the managed care companies that are not consistent. You've got CMS regulations that are also changing all the time, along with professional standards. They're very difficult for a provider to keep up with all of the changes at one time. Topping that, you've got the threat of additional reductions in Medicare, Medicaid, and the marketplace programs out there. So there's never been a time when getting your claims paid and paid appropriately has been more required than it is right now.
Makes sense. Yeah, we're hearing a lot about that. But I'm sure that as you're out there talking, you're talking to these healthcare providers and they're dealing with these problems. But there's probably I'm going to guess, some skepticism. So how do you deal with talking to a hospital administrator or a healthcare provider, large or small, medium, who says, what's the one problem that we help them to get past? How do you get past that skepticism?
Yeah, I think there's a lot of people doing various things with claims, but there's really nobody that's using AI the way we are to correct the claims and in real time file those claims again. And I think what happens most of the time is we'll hear providers say, does this really work? And we'll say, come on, let's demo and show you how it does work. And I haven't had one yet that didn't come back and say, that was impressive. It appears this really is a good system for us.
And that's what I've appreciated about Red Sky Health too, is in listening to you talk with your sales stories, is we're not showing this to people to go, no, I don't have that problem, or no, I don't need to solve for this. This is something that everybody in the industry, in the healthcare industry, is dealing with, and we're just finding a way that to help solve that. But with that, what's been what was your light bulb moment? Like you said, you've been doing this for quite a long time. When you first started to see Red Sky Health and what it is they're doing, and again, showing this live, what made you go, wow, we can change things?
Yeah, so throughout my career, a lot of it has been in the provider side, but I've also had an equal amount in the insurance companies, typically as the vice president of provider relations and network management. And I think the frustration seen by providers that are doing a really good job of taking care of their patients when they can't get paid is very telling. And it hasn't happened as much as one might think, but I've actually had times where providers called me and said, I can't make payroll if you don't get some claims paid. I've had regulators call me and say, I've got a provider that's willing to shut his doors if his claims don't get paid. You need to help them. That is the kind of stuff that I'm really glad Red Sky's got the solution for and we can help with. And that should never happen again. And I think we can prevent that in just about every case.
Yeah. I mean, you shared the story, I forget the exact the provider, but how we're helping we reclaim 25% of their I hate saying lost revenue, but it's revenue they're deserved. And they should be being paid that.
Yeah.
Tell me a little bit more about because that's a great sales success story.
Sure. I mean, this is a practice that's very well run. Husband and wife team. They've got about $2.5 million a year in top line coming in, and they're fighting for about 25% of it and losing on a lot of it. Now, in their particular case, they're in a market that's got a high amount of folks coming to visit for the winter. It's a warm weather location. So they've got people coming in with insurance companies from as far away as Michigan and New York, which they don't deal with every day. And every one of these systems, every one of these insurance systems has got a little bit different twist on things. So they take care of the patient, they file, and they almost have to hope and pray that they're going to get paid for it.
Yeah, that's unfortunate. I mean, they're just trying to run a business and take care of people and make money. That's their focus on the outcomes. So let's let's switch gears a bit. We talked a bit about some of the why behind this, which I think is important. There's obviously the how. Using the AI as part of what we do. How do you break down what it is we do with our AI solution, with our trained algorithm, to somebody who's a healthcare provider, but they're not a techie person? How do you help them tell the story?
Yeah. So most of the time, when you're looking at a small hospital, a provider practice, you've got people there that are good folks working hard that have learned the business, so to speak, by doing it. And what we find with that is that they learn when something's changed because the claim gets denied. That's an awful painful way to learn there. So Red Sky Health is in a position to actually load up those policies, those procedures as they change to prevent that from happening. Or at least if one claim gets denied, you're not getting multiple claims denied because the same mistake is being made. So I think it's that ability to immediately see what's going on, real time solution the problem, get the claim out and get it paid again. That's so very, very important.
So let's keep going because again, when it comes to technology, and you and I have both talked about this before, and I've helped sell technology solutions. It's one more piece of technology that you're telling me, Ted. You're going to do one more thing. How do you get people to be comfortable about, it's not another integration story. It's not a pain. It's a relatively easy process. But you and I know this. But how do you tell that story that to ease their concerns?
We do it for you. If we get it, if you let us, we will take your denied claims. We will fix them. We will coordinate with the physician to make sure that that's an appropriate fix. But once that's done, we will resubmit the claim for you. So you keep doing your business out there. You keep enjoying the work that you're doing, and we will get you paid. And that's how we prepare. That's how we do things.
It's a low impact process from everything I understand, which I love.
Yep.
So you say we'll get them paid. Let's talk about that. So, what kind of? I know we've been doing this for about 6 or 8 months. We've got some client stories we're telling. What kind of ROI are we seeing or expecting a provider to have from what they reach out for, they pay for the solution? How does this? And we talked a little bit about the bottom line. How does this help that bottom line?
So they should be able to reclaim about 95% of their denials. We take a small percentage of that, typically in an insignificant amount, and the rest of that goes right back to them. So when you're looking at the fact that you not only have the 95% of the denials are recaptured, but potentially are refiling as much as 25% of your claims out there, and a cost of refiling is not insignificant. There are different stories on that, but it's somewhere between $40 and $50 in the labor costs that are put out to do that. It's a win for everybody. You also have to look at there's 20% or so of the entire claims that are even refiled that never get paid under any circumstances. We can recapture the bulk of that. We can recapture just about anything that legitimately was done by a patient that had the insurance that they has insurance, not just the insurance they said they have, but they have insurance. And what I mean by that is a lot of our patients are confused about their insurance coverage, even which plan they have. We can fix that. So if you came in and you said, I've got XYZ insurance company, we filed a claim with that company and they said, this is no longer a member with us, we can find out who that member is insured by or was at the moment that the claim was administered, and we can get that paid for you without having to chase the patient down, which is a nightmare for most providers.
So to put it in real simple terms, because I'm a marketer, we're not asking for much money from the client, our client, but we're pretty much promising them a huge return on their spend. It just seems like a great opportunity.
A tremendous opportunity, plus getting rid of the headaches of dealing with the insurance companies. And I've been on both sides of that, as I said earlier. But typically when a provider would call us, they were in trouble. They had a lot of denied claims. They very rarely called you on one, unless it was very, very high. They had a lot of denied claims, and they would say, we need help. We don't understand what's wrong. And the amount of help I could give them at the insurance company was pretty limited. I might be able to say, I can talk to you about 3 of your claims. Unfortunately, then you have to get back in line, work through the queue again, which was probably 45 minutes, maybe even an hour to get through. That's a tremendous amount of staff time that's very unproductive and very frustrating. So I think we eliminate the headaches of this. We get your money back to you. We, give you a 95% accuracy rate. We only get paid for the claims so that we actually get the money back on. So if we fail to get you reimbursed, you don't owe us a thing on. There's no good reason to be continuing to put up with the claims denial nightmares that most providers are putting up with today. We have the solution for it.
That last sentence, I think, really is such a great thing to focus on. There's no to me, like everything I've been saying, there's no reason not to do this.
Yep.
But let's just play the game. Again, you're in sales and you're used to people saying no, thank you, Ted. What are some of the most common objections that you get to this that you got to say, I hear you, and how do you flip that into a win?
So these people are busy. The provider offices, the hospitals that you deal with have a lot going on, a lot of different people coming at them. Particularly at the larger systems, I've had people tell me, you're the 19th guy this month that's got a solution to my problem up there. And the best thing I can say to them is, I might be the 19th guy talking to you this month, but I'm the one that can really help you the most with the amount of dollars that you need to get through the door. And I can do it at no risk to you. I need 30 minutes of your time to explain how that's going to happen here. And I think that we find that works reasonably well with most people. We also now have some satisfied customers that are beginning to talk to their friends. And that's really, really important to us because there's more credibility there. And we try to promote that. And it's one of the reasons we really stand behind our sales and working so hard with our physicians and hospitals that we do deal with. We have a great reputation, and that's only going to get stronger as more people know about us.
Yeah, that's great. Yeah, just to see that kind of return is impressive. All right, so wrapping it up, Ted, you and I are stuck in the elevator, a potential client. You got 30 seconds from the floor 30 all the way down. What's the one thing you want me to walk away from as the door closes? Red Sky does.
We fix your claims problems and improve your revenue, and we drive your quality scores. All of that's done off of the claims. Take nothing else out of here. Remember those things. We fix your claim, get your revenue, we drive your quality scores.
It's a very low cost, low barrier to entry, high opportunity for revenue, better focus on patients, more time to spending where it counts. Did I miss anything?
No, I think you've hit it. I wrap up my part is by saying I have an outstanding PCP I work with, and he's actually my doctor. And I can't tell you how many times I've gone by and heard that he worked till 9 or 10 o'clock on the administrative side of the practice there. And, I want him seeing me and being bright-eyed and really ready to go. I don't want him up having been tired out from working all night on his claims problems. So I think we do a good job of stopping that from happening.
That's awesome. All right, Ted, thank you very much for the time. Anything else you want to add as we wrap this up?
No, appreciate it. And please give us a call. We'd love to talk with you. No risk, no fuss. We just want to talk to you and show you how we can give you a hand.
Oh, sounds good. You can find us at redskyhealth.com. And Ted, thanks for your time.
Thank you.